Well, ethics is either the easiest section in the entire course for you, or it's one of the hardest. It depends. If you have an experiential base, ethics will seem like one of the easiest things. Now, ethics is also one of the easiest things from one point of view because you don't have to agree with anything. You can in fact say, look, I totally believe in euthanasia and physician-assisted suicide. I totally believe that you should be able to break confidentiality anytime you want. But on the test, when I get there, I'm going to say no physician-assisted suicide, no euthanasia. You can't break confidentiality for anybody unless somebody else is going to get harmed. And these are the rules. So in this section, you have to suspend your idea of what your own personal beliefs are, only in the sense that I'm telling you what the rules and the legality is. In many ways, it's not even my own personal opinion because you're not tested on your opinion or my opinion. These are simply the standards of care for right ethical behavior in medical ethics. Now, I know what some of you may be thinking. Conrad Fischer, the way you talking about ethics, huh? Yeah, you got some nerve. Well, that's because this is not a section on social decorum. It is a section on right action. And that the core of all ethics in the American system and Western system is autonomy. The concept that you have the ability to do what you want with your own body. This is based on our tradition of law that says, with the exception of taking care of someone in an emergency, because in an emergency, consent is implied. Oh my God, you got hit by a car. I hope not. You got hurt, you got injured, you fell out of a tree. The natural thing is you must have wanted to be treated. Oh my goodness, you're bleeding. You must have wanted that blood transfusion. Oh no, he once told me he was thinking about becoming a Jehovah's Witness. But how do you know? Well, he sort of said it once, but you don't know. You don't know. It's an emergency. Give him the blood. So when you don't know what to do, you'll say consent is implied. The most frequently tested subject on autonomy is that it seems like it's a short sentence, but there's a lot in here. First of all, adult. Adult is defined by the age of 18. It's defined by the age of 18 because that's when you can vote. That's when you can go unrestricted into the military. There are a couple of exceptions where you can go a little younger, but you're an adult because minors have no rights. Little minors have zero rights. Minors at the age of 15, 16, 17 will have rights for some exceptions like sexual things, contraceptions, prenatal care, and substance abuse stuff. And you have to have capacity. Again, that may seem a very small issue, a small number of words, but with capacity is huge. Do you have decision-making capacity? Doctors determine decision-making capacity, courts determine competence, and the capacity to understand. How do you know they can understand? Because they can say it back to you. So to have autonomy, decision-making capacity, you have to be an adult and you have to understand the nature of the medical problem. Seems small, but that is the whole core upon which all the questions are going to be based. Doesn't matter if the treatment or the test or the therapy is painless. It doesn't matter if it's effective. It doesn't matter if the person's going to die without the treatment. An adult with capacity can refuse anything. You can say to the person, hey, you have a disease that I can cure. You have a disease I can cure with one simple injection and it'll be gone. Syphilis is a very good example of that. You have a disease I can cure. 95% certainty you have lymphoma, that without treatment, you're dead. With treatment, you'll live. And the person goes, I don't want it. You have coronary artery disease. I can do angioplasty. With the angioplasty, you'll live. Without it, you'll die. I don't want it. HIV. One pill once a day. With the treatment, you'll live. Without the treatment, you'll die. I don't want it. Are you an adult? So you mean, technically speaking, you could take a 6-year-old, 8-year-old, 10-year-old, 12-year-old and force feed them the meds? Yep, absolutely. And if you have no decision-making capacity because of encephalopathy or psychiatric illness, you can force feed them the meds. But the ability to refuse has nothing to do with the benefit of the therapy for the patient. That's beneficence. Beneficence means that I can subjugate your own decision-making capacity and autonomy to the fact that I'm doing the right thing for you. Here, let's give an example of this. If you gave me tickets one of those sporting things, World Cup, Super Bowl, World Series that includes 2 countries. And you said, I'm giving you this ticket, Conrad, because I love you. You're a great teacher. I want to help you out. I don't want to go. Yeah, but I gave it to you for free, and those tickets are worth a lot, and you should show some more appreciation. Well, I appreciate you trying to appreciate me, but I'm not going because it's not my thing. I'd rather be making videos for step 3. So my autonomy exceeds the benefit you're trying to do for me. Conrad, I'm going to give you a Lamborghini. It's a $200,000 car. I appreciate that, but I don't want it. But you understand I'm giving it to you freely? Yes. I understand that. You understand it'll benefit you? Yes. You could sell the thing. I still don't want it. Respecting autonomy is more important than doing the right thing for a person. There's a perfect example of that. Or beneficence. I'm trying to do the right thing for a person. Because that's justice, baby. That's justice. A 35-year-old mentally intact patient with decision-making capacity has stage 1 lymphoma. Treatment is this is the fact. A young person, 95% chance of cure with radiation and chemotherapy. What do you do? Well, here's where test-taking ability comes in. Let's look at these. Try to discuss it, honor his wishes, get a psych consult, ethics committee, court order. Okay, let's look at these. The answer is, for step 3, they always want you to discuss things. So let's put this back again. He has the right to refuse, for sure. But step 3 wants you to talk to people. If there's an answer on an ethics question that says meet, confer, discuss, persuade, explain, advise, the answer is always first. Discuss, meet, confer, advise. Step 3 is like the UN. Discuss, meet, confer, advise. And in the end, the individual countries do what they want. What do? Discuss, meet, confer, advise. I saw a case, very unfortunate case, a couple weeks ago. Guy was in a boxing match. He took a hit in the head, and he herniated, and within 48 hours, he's brain dead. Brain dead. He's dead. Brain dead equals death. There's a family of 25 people, including the mother, and I'm within my rights as the head of the hospital ethics committee, which I am. I'm the head of the hospital ethics committee for several years. I'm a minister. I have a degree in theology. And I'm also the doctor responsible for things. And I had the right to say, that guy's dead, and switch off the machine. Because he's dead. He's brain dead. But what was the right thing to do? Family meeting. Discuss. Confer. Advise. Now, if you meet, can discuss, confer, and advise, and he still doesn't want to do it, then the answer is honor his wishes. Psychiatric consultation is the answer when? Psychiatric consultation is the answer when the question says, we're unclear if there's decision-making capacity. We're unclear. If he clearly has decision-making capacity, you do not need to get a psych consult to allow people to refuse. You don't. Second thing is this, is that if the person clearly has no capacity, then you don't need a psych consult because it's clearly no capacity. So if it's clearly yes or clearly no, no psych consult, for sure. Psych consult is only if the question says equivocal, uncertain, get a second opinion. And by the way, it doesn't have to actually be a psychiatric consult. It could be anybody asking them to help. Neuro or another doctor. Next, ethics committee. Ethics committee is if you have a person who has no advance directive, they have no living will, no proxy, they didn't designate anybody to make decisions for them, and it's unclear what their wishes were, they never put it in writing, and the family and everybody in the family is like, I want this, no, I want that, no, I want this, no, he want that, he wanted this, I don't want this, and everybody's split and confused. Ethics committee. Ethics committee is also the answer when the family is all united around insisting on therapies that will not make a difference. They're insisting on therapies that are futile. They will not change an outcome, but they want them anyway. That's the single most common reason for a call for ethics committee is patients, families demanding futile care that will not benefit anybody. Court order is always dead last, and that's why it is dead last in the choices here, because a court order is when you get the ethics committee and the family is split, the ethics committee is split, and you're not certain what to do. The last thing is the court order. The court order is also the answer when the ethics committee for the hospital, ethics committee which is comprised of doctors and nurses and legal and clergy and community representatives, and the ethics committee says this therapy is definitely futile, that person should not go on dialysis, that person should not be on a ventilator, should not get a trach, should not get a peg, that person should be allowed to die. And the family goes, absolutely not. We want a trach, a peg, dialysis, and tattoo removal. And you can't come to agreement. Court order. Court order. Capacity. How do you determine if someone has capacity? Capacity is determined by physicians. Competence is actually a legal term. And capacity is most often determined by talking to patients, and you make a judgment or an assessment about whether someone can understand you, which usually is based on them being able to say back to you things like this. Listen, I know I got lymphoma, and I know that therapy will get rid of the lymphoma. I understand that. I understand that I will die without the therapy, but that is my choice. Oh, well, he has capacity. He understands it. Psych consult is only when it's not clear. It's not necessary if the person is clearly competent. Now, I have this in here twice because this is one of the biggest reasons to be wrong. Why? Because in the ethics section, unlike, let's say, pneumococcal vaccine, you look up pneumococcal vaccine, it says 13 polyvalent, a year later, 23. Tdap, every pregnancy. There it is, it's in writing. But ethics, people don't study it in the same way, and people come in and they say, oh, well, I was told that to determine that someone has no decision-making capacity, my attending told me, or I heard, or I thought I was under the impression that you had to have a psychiatric consultation. That's what I was told. And people don't look it up as much because it's not as clear. So that's why it's in here to say psych consult not needed. Now, minors have no decision-making capacity. Minors, in many sense, boy, my publisher used to object to this, but let me say what it is. Minors have about as much decision-making capacity as your dog. And your dog does not get to choose when you walk it or not walk it. The dog does not get to choose the food you serve it. Now, you can't abuse the dog, you can't mistreat the dog, starve the dog, hit the dog, abuse the dog, but the dog can't refuse whether or not he's going to eat fish or chicken or eat vegetable tonight. So by age 18 is by definition decision-making capacity. Now, the emancipated minor means this. It means you may not be 18, but you are 17 and you're in the military, because with certain permissions you can go in at 17. You're 16 and you have a driver's license and you're self-supporting and you work a job and you take care of yourself and you're not dependent on your parents. You're a self-supporting, independent person. You may not be a legal adult, but you have the ability to support yourself. An emancipated minor, meaning emancipated for everything, means people that although under 18, they can make their decisions because they are people who live independently and are self-supporting. So you're determining adulthood based on the ability to take care of your activities of daily living. Yes, I pay my own bills. My father and mother don't support me. I take care of myself. I'm married outside the house, or I'm in the military. These are people who are considered emancipated. Now, this is a matter of local tribal customs. In New York and in Chicago, emancipation happens somewhere around 40. Other parts of the country, it's younger. Now, minors are partially emancipated for things that we think that it's in the benefit of the person to have decision-making capacity, such as the decision to be able to use contraception even as a 16 or 17-year-old, and to be able to, if they're pregnant, go get prenatal care, or if they're 17 and 16 and 15 and they have a substance problem and they want treatment, they want to go into detox, and they want to go into rehab, they want to go into therapy. And what we know is that this being partially emancipated to get rid of STDs as a young person so they don't transmit, and especially contraception, this has led to the lowest rate of teenage pregnancy in the history of the country. And I know it will seem paradoxical, but are people having sex younger or older? They're having sex older. The age of initiation of sexual activity is actually rising, not going younger. Wow. So emancipated minor for everything? For everything. Emancipated for everything. Self-supporting, married, living independently, the military. Partial emancipation is for sex, contraceptions, reproductive health, prenatal care, substance abuse issues. That also fits in with HIV. In other words, an HIV positive person, you don't have to disclose to the parents if the kid's HIV positive because it's an STD. Now, sometimes people get worked up about things for which there's no real clear answer. For instance, abortion. Since the states are divided on abortion rights and gun rights, the abortion issue is that parental notification for abortion is true in some places and not true in others. So that means that they're going to ask you some namby-pamby answer, like you're going to say, advise the patient to tell the parents. Because you can't say this legality is not true in every state. So for it to be true on USMLE, which is not the New York MLE or the Texas MLE or the Indiana MLE, it has to be true everywhere. And it is true everywhere that STDs, prenatal care, contraception, substance issues, you're partially emancipated in all states. Not true for abortion. Honey, you should tell your mother that you want an abortion. Now, informed consent is based on the idea that anybody who's got autonomy and has decision-making capacity has to be told about the goods and the bads about every decision to make a truly informed consent. Now, this again seems like a really straightforward idea, but if you're a minor, minors, a 14-year-old and a 12-year-old is not allowed to make an informed consent and sign consent for their hip repair or their lung biopsy should they need it or their bone marrow transplant. Only the adults can do that. The second thing about informed consent is that in order for it to be truly informed, the person has to be able to understand it. And that means, what if the person can't understand the English language or the language that is spoken in that person's country? And since it's the USMLE, we'll assume that's English. And the answer is that the doctor and the healthcare facility has a duty to provide translation services. What? I got to translate? Let those people learn English. Actually, no. You have the duty as the doctor to provide translation services about the benefits and the risks and the alternatives. Now, this one about alternatives are really big because what if you say to someone, look, we need to do cardiothoracic surgery on you. We need to do bypass. Or we need to do a valve replacement for your aortic valve. I want you to know that a valve replacement for your aortic valve has a risk of infection. Do you understand that? Yes, I understand. Cutting my chest has a risk of infection. It has a risk of bleeding. It is a risk of that valve replacement that later you may need anticoagulation, may cause you bleeding, that you can have a risk. In fact, to be honest with you, a heart-lung bypass machine, the most common abnormality, the most common complication of being on a heart-lung bypass machine is actually something called neurocognitive dysfunction. Pump head, you lose points of IQ, you're kind of slow in your uptake. And to be direct, cardiothoracic surgery will kill some people. It'll kill a couple of percentage people, but we will replace your valve. We'll do the best we can. Do you understand these risks? Yes. Is it informed consent? Tell me what the risks are. I have a risk of infection. I have a risk of bleeding. I have a risk of neurocognitive dysfunction and mental slowing. And in fact, I have a risk of sudden death because I can have an arrhythmia. So you said it back to me, you understand the risk. Are you over 18? Yes, I'm 70. Okay, are you over 18? Do you have decision-making capacity? The value, okay, the circumference divided by the diameter is the value of pi, 3.14. Is that enough decision-making capacity for you? Okay, he understands what the value of pi is, circumference divided by the diameter. Pretty good. Is it informed consent? In a way, it is informed consent. I've told the person about the procedure. I've described the complications. They are an adult. They have decision-making capacity based on my judgment and based on the fact that they have repeated back to me what I've said, and it shows to me they understand it. It is almost all correct, except for one thing: alternatives. It is not informed consent if I didn't tell the patient that we have TAVR, transcatheter, transvenous aortic valve replacement. I didn't tell them that although it's not valvoplasty, it's not a balloon, that we have an alternative, that there is a procedure that I don't do, but other doctors do, that with a catheter, I can replace the aortic valve. I didn't tell him because I'm in the business of doing bypasses. He understood, but he signed consent without informing him of the alternatives, then it's not informed consent if you haven't told him about the alternatives. And that's the fact. TAVR, with a transcatheter aortic valve replacement, that is a valid alternative that you didn't tell people. And in the language they understand. Now, consent also has to be for each individual procedure. I get consent for you for an appendectomy. When I go in to do your appendectomy, I notice that you have an ovarian lesion, and I should take out your ovary. I have to wake you up and ask you if you wanted that to happen. But doctor, that could be cancerous lesion. You can't just leave that cancerous lesion in there. Actually, unless you signed consent for the ovarian removal, or I saw cancer spreading outside your prostate, or whatever sort of other thing we can find inside the abdomen that I didn't know about. I found an aortic aneurysm that I didn't know was going to be there. Unless I asked you to sign that individual consent, you have to wake the person up and say, hey, I found this other problem, I need to do this other thing. Because the person may very well say, I don't want to do that. Oh, what do you mean you don't want to do it? It's good for you. Or the person may say, I do want to do it, I just don't want you to be the one doing it. Oh, let me give you an example. You go to take your car to be repaired. You think that what you need is the oil changed or some minor thing with a fan belt. I don't understand. I don't understand cars. But they go in there to fix the first problem. While they got the hood up, they see a different problem with the hood, in the engine, and they decided to fix it, changed the part, and handed you a bill and said, listen, I know you brought the car in for me to fix the transmission, but I found something wrong with the engine. I replaced the engine. Here's the bill. But you didn't ask me if I wanted that other thing fixed. So if you would understand that in terms of your car, it's the same thing in terms of informed consent for your body. So why don't you just say, instead of saying my body, say my car, my house. Oh, you wouldn't allow the workman to fix your house in some way unless he'd informed it, and you tell him he's got to explain it to you in the language you can understand, except in an emergency. I went in, and while we were in there taking out your appendix, I noticed that you had a ruptured vessel, which I had to fix. I noticed that you had a perforated colon, which I had to fix. And I couldn't wake you up because it would have harmed you. Because can you imagine the other way around? Doctor, what happened to my father? He died. What do you mean he died? He had a routine appendectomy. Yes, but I noticed his aorta was rupturing, but he didn't sign consent for repairing an aortic rupture, so I decided to wake him up, but he died before he woke up. Doctor, it's an emergency. He would have signed consent. Consent is implied in an emergency, unless the prior wishes are fully known. I have a Jehovah's Witness. Well, I think he's a Jehovah's Witness. Actually, I had a patient like this one. She was a Jehovah's Witness when she was a kid because the parents were Jehovah's Witnesses. She came in for her pregnancy and in the bad old days of early HIV had very severe anemia with a hematocrit under 20, hemoglobin under 6. And somebody says, we can't transfuse her, she's a Jehovah's Witness. And she was actually losing consciousness. And I go, transfuse her. Transfuse her. When she woke up, she said, I was a Jehovah's Witness because my parents used to drag me to it when I was a kid. I'm not a Jehovah's Witness anymore. Thanks for the transfusion. Got my point? Now, plan B. A person who is a Jehovah's Witness carries a medical alert bracelet and has something in their wallet that identifies them as a Jehovah's Witness, and they have a sign of a refusal for blood transfusion in their possession. They end up in a car accident, it's on their medical alert bracelet, it's in their possession, no transfusion. Why? Because the prior wishes are fully known prior to this procedure. Emergency procedures. Can consent be taken over a phone? Sure, it can be taken over the phone. You can vote for president with an absentee ballot. Sure, it can be taken over the phone. Hi, doctor, what happened to my mother? She died. What do you mean she died? Well, your mother needed this particular procedure, but she didn't have decision-making capacity, and the proxy was someplace else. We would have had to call them. Well, why didn't you call them? Call them. It's phone valid. You can do consent for a heart-lung transplant over a phone. Next, if the patient's not there, you can do phone consents. They are valid. How do you know? How can you prove it? You have two people listen, and then you document it. Pregnant women can refuse therapy even if the life of the fetus is at risk. I'm a Jehovah's Witness. I don't want transfusion even if I die. She can refuse. Even if the baby dies? Yes. An HIV positive person can refuse antiretrovirals. This doesn't happen much anymore. It used to be a big deal. What do you mean you're refusing HIV medications? You got 2 T cells and your viral load is 70,000 and you have twins. That one happened to me a couple months ago. You're 36 weeks pregnant, you're about to deliver, you got twins, and your virus is out of control. Take the antiretrovirals. She didn't want to take it. Ultimately, she did, but she had the right to refuse. Now, let's look at it this way. You know that we give AZT during delivery for pregnant women. So she's in labor, and she says, no antiretrovirals. She's 10 centimeters and dilated, no antiretrovirals. The baby might get infected. No antiretrovirals. The baby comes out of the vagina and she said, I don't want antiretrovirals for my baby. Wrong. She can't refuse for the baby. I'm a Jehovah's Witness. I don't want the transfusion. You and your baby, your fetus may die. I don't want it. She can refuse. The baby's not born yet. The baby's 10 centimeters and crowded. I don't want the transfusion. She can refuse. The baby's out. I don't want a transfusion for my baby. Wrong. So when do you become your own independent person, gentlemen? When do you become your own man? And the answer is, as you suspected, when you get your head out of the vagina, you are your own independent person, and mom can't refuse for anything for the baby that's life-saving. Matter of fact, what parents can refuse for their children is relatively narrow. They certainly can't refuse anything life-saving. The pregnant woman can refuse even if the life of the fetus is at risk, but once the baby comes out, she can't refuse for the baby. Next subject, confidentiality. A patient has an absolute right to privacy about their own medical information. And family members, employers, friends, spouses, not only do they not have the right to medical information, it is a very serious violation to give or to even accidentally let people see protected health information. You're in the hospital and you leave the computer and you didn't sign out, and then somebody walks by and sees the medical information about a patient that's not theirs. This is a serious violation. People can lose their jobs. People can be suspended. People can lose, here, I'll give you an example. A nurse gets assaulted in the hospital, very seriously. Some staff members, being curious, couldn't resist, went into the record and looked at her medical condition. They were not taking care of her. They just were curious. They were suspended, 10 of them. Suspended from the hospital. And they had to report it when they applied for state licensure. And so some people actually had a holdup of their license. Some people actually weren't allowed to be licensed in certain states because the hospital had a duty to report a suspension for violation of hospital policy. In this case, the violation of the privacy of protected health information. And it's not because they were just fellow employees. It could have been anybody. No right to that information without the patient's express consent, which means that if you're a caretaking physician, the patient has expressed consent that you should see their protected health information. So members of law enforcement can't come by and say, I'm from the the CIA, FBI, USMLE, and I want protected information. I'm sorry, officer, can you show me your court order? Do you have a court order? Do you have a subpoena for those records? If you have a subpoena, court order, please go to the legal department and we will make sure that you get what you have a legal right to, but please show us the subpoena or the court order or the official thing that allows you to violate confidentiality. I don't have a court order, I don't subpoena, but doctor, don't you want to keep America safe? You're not with the bad guys, are you? You know, doctor, you can get in very serious trouble for obstructing justice. Yes, well, I'm sorry about that, but trying to go into people's protected health information without a subpoena, a court order, or without the patient's of consent is actually not justice. And that's a question for you. The question will be put like that. That'll make it out like you're the bad guy. And the answer is no, you don't have a right to it, unless they have these legal documents. Now, there's not an absolute right in all circumstances to confidentiality, because what if the person has something that might be harming other people? For instance, what if the person has HIV and they've been putting someone else at risk? You have the right to go and to make sure that someone, if they're known to be HIV positive in the record, you stuck yourself on a patient's needle. And you want to know if the person's HIV positive so you can take prophylaxis. You have a right to that information. What if you know that the person has an STD? You have the right to have the confidentiality impaired, changed in order to protect third parties. Confidentiality can be broken to protect other people. For instance, a patient with a psychiatric disorder discloses to you that he's going to harm someone. You have the right to inform people for sure. The Tarasoff laws are the biggest ones. Look, think of it like this. What if you were in a restaurant and you knew that the food the romaine lettuce had E. coli? You have a right to break confidentiality to tell people about E. coli. So the protective privilege ends where people in the public are at risk. Now, when people are informed about STDs, we don't walk up to you and go, hey, you know, Bob's got AIDS. John's dirty. He's got chlamydia. That's not how partners get informed. Partners in the public get informed like this. Dear Conrad, please come and see us at the health department about an important health concern that affects your safety. Holy crap, what is it? What is it? Conrad, we're here to tell you that we think you've been exposed to HIV, hepatitis C, hepatitis B, chlamydia, syphilis, any of them. Who? Who did this to me? Who did this to we can't tell you. No, but you have to tell me. I have a right to know. Actually, you don't. You don't have a right to know. But what we're going to do, if you'll go down the hall, we're going to test you for all those things and get you treated if you got syphilis or HIV or hepatitis C or all the others. But I have a right to know. No, you don't. We're not telling you. So that's the kind of way that we inform people with partner notification. You have the right to break confidentiality to alert people that they may be at risk of harm. And that's the key issue, is risk of harm. You have the right to disclose information if it will harm someone else. And you don't have the right to disclose. And as a matter of fact, you have a duty not to disclose, even if very scary, powerful people show up and say, "Doctor, you better tell us." End of life issues. Autonomy at the end of life is a huge issue because, first off, let's say if you're an adult with decision-making capacity, you have the right to refuse anything, any treatment. If you're an adult with decision-making capacity, you can certainly refuse any medical test or treatment, but do you have the right to refuse nutrition? Because honestly, you're not going to get in trouble or have a hard time with the guy that says, "I don't want the open heart surgery, I don't want chemotherapy, I don't want my A, B, and C done, and I accept the consequences." You're going to have a hard time about things like basic comforts, fluid and nutrition. If you're an adult with capacity, you have the right to refuse anything, including food and nutrition. Why don't you think of it commonsensically? You go to a restaurant. In the restaurant, you're not very hungry. You say, "I'd just like an appetizer." And in the restaurant, they say, "No, you have to have the whole meal, including dessert." "But I don't want dessert." "You came to the restaurant, didn't you?" So, now, the same way, withholding and withdrawing care. You're in the restaurant. "Do you want dessert?" "No." "All right, you know what? Fine. I'll take the cheesecake." The cheesecake arrives. In between the time you ordered it and the time of the arrival of the cheesecake, you decided you really don't want the cheesecake. And somebody said, "No, you ordered it. Shut up and eat it." No, refusing the cheesecake and withdrawing the cheesecake after it arrives are ethically indistinguishable. I go on a chemotherapy. Halfway through, I decide I don't want the chemotherapy. I have the right to withdraw. So they are ethically indistinguishable. And one of the hard ones, though, is patients who are intubated. A person says, "I will allow myself to be intubated and put on a ventilator." After he's on the ventilator, he goes, "This sucks. Take this out." You go, "No, you allowed the intubation. No, you have to continue." And the answer is no. Now, what about people who have no decision-making capacity and dad gets intubated? In the next day, the son shows up and says, "Look, I got the proxy here. I'm the proxy. You intubated him. See in this living will? No intubation. We got to check it out." And the whole medical team freaks out and says, "We can't take it out. He's intubated. He'll die without it." "But it says here, no tube." "Yeah, but he'll die without the tube." "Yeah, but it says here, no tube." "Yeah, he'll die without the tube." Did he make this decision when he had decision-making capacity? He did. Pull out the tube. You got to pull out the tube. As a matter of fact, why did he say he didn't want the tube? He said he didn't like the taste. Well, that's a whimsical and stupid reason. It was his reason. Why'd you choose pumpkin cheesecake? I don't know. I just wanted it. That's a stupid reason. The reasons are irrelevant. We just don't want it. So what happens if you are not in a position to decide? These are really hard for people. You have to leave a set of instructions about decisions for yourself if you lose capacity. And that healthcare proxy is also called the durable power of attorney. Durable power of attorney. And durable means that when you lose decision-making capacity and you can't make decisions for yourself, this other person has in perpetuity the durable power of attorney to make decisions for you Even if you never regain consciousness, it's durable. And the strongest advance directive is a healthcare proxy saying what you wanted the person to do, where you say, I want this person to make my decisions for me, and they're the proxy. And that agent can make decisions. And the hardest one is, though, is that when the patient said, I never want to be intubated, but the proxy, the person, comes by and says, well, there's a temporary intubation, I think I'll allow it. That's an unanswerable question. That's an unanswerable question that would go to the ethics committee. So step 3, I can't expect you to answer unanswerable questions like, well, I'm thinking he had decision-making capacity, but I'm not sure if he had decision-making capacity, but he probably did. What are you going to do with that? There's no answer to that one. So healthcare proxies, though, don't take effect until you've lost decision-making capacity. There's a nice joke, isn't it? Hi, what are you doing? Well, I'm here to pull you off a ventilator. Well, I have decision-making capacity. I want the ventilator. No, but I'm your proxy and I say pull it off. These things don't take effect until you lose decision-making capacity, in the same way that you say your grandmother decides to leave you her car. You have a copy of the will, and you go over to your grandmother's house and you say, hi, Grandma, I'm taking your car. And she says, sweetheart, that's if I'm dead. No, but it says here, I get your car, I'm taking it now. No. Proxies and living wills take effect once people lose decision-making capacity. A proxy or agent is a person. A living will is a document that outlines the decisions that people wanted for themselves. So if there's no proxy, no person, and a person outlines what they wanted for themselves, then it's like a will, like when somebody says, hey, this is what I want done with my house or my car. Remember that your body is your most important piece of property, right? So it's the same thing as saying what you want done with your most important piece of property, your body. Now, if the person says, I never want to be intubated, that's very clear, isn't it? If the person says, I never want a transfusion, that's very clear. I never want chemotherapy. I never want a transfusion. I don't want to go to a nursing home ever. I don't want to have a tracheostomy ever. Or I do want all these things. That is clear. It is clear if a person writes a living will with specific procedures, transfusion, dialysis, intubation, gastric or PEG tube. That's very clear. But when a person writes, or somebody says, he didn't want heroic measures, what does that mean? Oh, nothing heroic, nothing. What does that mean? You don't want Thor to appear and strike lightning? Iron Man? Captain America is not supposed to show up? What does that mean? It's not clear what that means. Okay? Hey, I'm going to the restaurant. What would you like to eat? I want some really good food. Yeah, but what do you want? The really good food? It's not clear. The living will has to be clear and precise to be useful. Now, do not resuscitate orders, and then to tracheal intubation, no cardiopulmonary resuscitation, that's all it means. It doesn't mean that you can't have surgery. It doesn't mean that you can't have blood tests. It doesn't mean that you can't get antibiotics. It doesn't mean that you can't get chemotherapy. It doesn't mean anything except if your heart stops or you can't breathe, we don't push on your chest or shove a tube in your mouth. That's all it means. So if a person has an adult with capacity, he can refuse or accept anything, including fluid nutrition. Next, if a person has no capacity, then you need a proxy, that's a person, or a living will that's clear to make decisions. But what happens if there's no proxy and no living will, and we don't know what the person wanted? Then you have to say, what is your understanding of what he wanted? Oh, wait a second. Well, our father never really told us what he wanted. But I know that I want him to have everything. I know I want him to have everything. Yeah, I want him to have everything too. You want him to have everything. You want him to have everything. Oh, that's great. What is he, the Dalai Lama? Make me one with everything? What did the Dalai Lama say to the hot dog man? Make me one with everything? He gets his hot dog with everything, gives him $10, and he says, hey, give me my change. And the hot dog man says to the Dalai Lama, no change. Change comes from within. Okay, so the thing is, what does it mean to say I want to have everything? It's not clear. It's not clear. And you don't have a right to everything. You have a right to things that will make a difference. So if there's an adult with capacity, they have the right to whatever they want to have or refuse as long as it'll help. If there's no capacity, you go to the proxy and living will. Now, most people don't have a proxy, don't have a living will, and then they lose consciousness. You have to say to people, what did he want for himself? I want everything from my father. I want him to be on a ventilator, or I want him to be on dialysis. Is that what your father said he wanted for yourself? Because I never heard of a person who said in the event that there's no hope of recovery, maintain me like a vegetable on a ventilator. I never met that person. Well, that's what we want for him. But what did he say? Here we go. A man has a syncopal episode, loss of consciousness, CPR for 15 minutes, and he's brought to the hospital with very bad mental status. The wife shows up and says, well, from what I know about my husband, he's the kind of guy that would have wanted to be left alone. And so from what I know about him, he wouldn't want to be intubated. I think you should take him off the ventilator right now, because from what I know, or the kind of guy he is, and we've been married for 50 years, he's not the kind of guy that would have wanted to be on a ventilator. He would want to die right away. The friend shows up, and the friends show up and say, well, you know, it's interesting. We were out just the other day at the bowling alley. We just had dinner. We went to the movies, and we talked about this because we're all 75 years old. And he said to us that he wanted to be intubated and to try for a while to see if there's any hope of recoverability. And he said that to us just last week. So who wins? The wife says, well, he never told me, but from what I know about him, and I've been living with him for a long time, is he's not the kind of guy that would ever want to be on a ventilator. The friends. You know, it's funny, we were talking about this just the other day at dinner, and he said that he wanted to try a ventilator in case there's a hope of recovery. So the people who win are the one who said, he told me. So the friends win, because he expressed his wishes to the friends. Kind of like this. Hey, Conrad, he seems like a liberal guy. I bet he'll vote super liberal, vote super left-wing Democratic. Yeah, but what did he tell you? What did he tell you? He told me he was going to vote for the conservative. Yeah, but that's not the kind of guy he is. Yeah, but he told me he was going to vote conservative. He told me. Now you understand. What did they tell you? Okay, the family is split. Ethics committee. Nobody knows what's going on. Patient's an adult who doesn't have capacity. There's no clearly stated wishes. The family, the caregivers are in disagreement, or the family is in agreement and they want things that are futile. That's what the ethics committee is for. Ultimately, what happens when everybody's split? What happens when the ethics committee and the family can't come to a decision? You go to the courts. When all the other options don't work, if there's disagreement after the ethics committee, if the ethics committee can't agree, if the ethics committee disagrees with the family and the family won't change their mind, ultimately, at the end, dead last, is court order. In the last 3 years of me being the head of the hospital's ethics committee, we've never once actually had to go to a court order, because once the ethics committee comes to agreement and we discuss it with the family, we have been fortunate, but once the family is confronted with, we, the doctors, nurses, caregivers, administrators, legal, ethics committee, clergy, and community representatives are informing you that this care is futile. We cannot ethically give it. You have the right to find another caregiver, but we cannot ethically do this. And we've actually never had to go to the courts. But that's the last thing, by the way. What happens if somebody says, I know that my mother's a vegetable, but I want her to get all this care? I can't give that. Ethically, I can't do it. But you have the right to find a different doctor who might do it. Patients with capacity can refuse all forms of nutrition, even if it means they'll die. The same way you have the right not to go to a restaurant. You ever can be a prisoner who goes on a hunger strike. You can't be force-fed. There's no ethical basis, ready? There's no ethical basis for forcing fluid nutrition on a patient. There's no ethical basis even if the person knows they'll die. If it's not an adult with capacity, the proxy in the living will can refuse it. In other words, you say, well, my father or my mother, she's lost consciousness, she's got severe dementia, she's non-communicative, she doesn't walk, she doesn't talk, all she can do is feel pain. But she told me very specifically, I never want to be maintained on a feeding tube. I don't want to be maintained on a ventilator, no feeding tubes. Thank you very much. But it must have clearly expressed wishes when competent. Physician-assisted suicide. Physician-assisted suicide is not euthanasia. Euthanasia is the doctor says, I'm going to give you this substance that's going to end your life. Physician-assisted suicide is the patient says, doctor, I would like you to give me these medications so if I get to a point where I think I'm not going to recover, I want to end my life. And now, even though there are several states in which it is legal, it is not considered ethical. This is hard for people. What's the difference between legality and ethics? Legality can change in a second. You can have an election, the government changes, and something that was illegal yesterday can be legal the next day, and the other way around, and legality can change like that, like that, like that. Most dictatorships came into being by legality. They changed the laws, changed the Constitution, changed the legislature, and the legislature can vote for anything. But no matter how many states say it's legal, it's not considered ethical. Now, what's the difference between saying, doctor, I need pain meds to relieve my pain, and what's the difference between that and saying, doctor, I want you to prescribe me this cocktail of pain meds so I can end my life? The answer is intentionality. If the intention is to relieve pain, it is ethical. If the intention is to end life, it is unethical. This is one of those times where I told you, you don't have to agree with it. You don't have to disagree with it. It doesn't matter. It's the rules. Euthanasia is the physician says, this person is suffering, I'm going to end their pain by ending their life. It is always wrong, euthanasia, and there is no state in which euthanasia is correct. Okay, so what's the difference? I have a patient who's got COPD and severe pain. In order to relieve their pain, the only way I could relieve their pain was to give them enough opiates that it relieved the pain, but it impaired their breathing and they died. Ethical? Not ethical. Ethical. Why is giving opiates to relieve pain, even if it shortens life, ethical, but euthanasia is not? And the answer is the intention. If my intention was to end life, not ethical. If my intention was predominantly to relieve pain, ethical. A patient needs pain medications. The pain medications cause severe constipation. I give the pain medications, they relieve the pain. I give other medications to relieve the constipation. Ethical. I give you pain medications because I want to make you constipated. Unethical. You know, I was in the hospital last year, and this guy, who I had met like once for 10 minutes, walks up to me while I'm asleep and jams 3 knives in my abdomen. I met this guy for like a couple minutes. And while I'm asleep, he stabs me in the abdomen 3 times. You know what we call a guy like that? A surgeon. I had my hernia, my mesh ripped while doing incline board sit-ups, and he had to do laparoscopic surgery. And he had to put 3 holes in to fix it. It's a surgeon. I walked up on the street and a guy without my consent, stabbed me. No, that's assault. What's the difference? Intention. The intention was to help me. So that's the difference between these. Pain medications that are intended to end life, unethical. Pain medications that relieve pain and may shorten life, ethical. And that's actually even the position of the Catholic Church. The Pope, John Paul, said this. He said, so this is actually a matter of ethical, even within all the world major religions, that if the double effect, that if the intention is to save life, it's okay. The difference is intent. That's why. That's what the difference is between these. Now, feudal care is hard. Patients don't have unlimited right to treatment. It's hard because doctors and caregivers want to do what patients want, and they want to give them what they want. So when a family member says, I want everything, people tend to want to do this. And then they get angry too. And they're like, you do everything or I'm going to get you, doc. But the thing is, I don't have an obligation to provide care that will not work. I had a patient that a guy with AIDS, and he insisted on medications to gain weight. And I said, you're obese. He goes, no, I want this medication that I know stimulates appetite. I go, but you're not thin. And I said, look, I can't do it. He goes to the nurse calls me. No, I can't do it. He goes to the clinic director. No, I can't do it. He goes to the other doctor and says, hey, your patient says you're a crappy doctor because you won't give him medications to gain weight. I'm like, I won't. And so eventually what ended up happening is I had to write a letter that said to the guy, for the administrator, and to him, and go, dear Mr. Such and Such, I am no longer able to take care of you. I cannot provide this medication for you. It is not within I am not ethically unable to give you care or treatments that will not benefit you. I'm going to give you 30 days to find another doctor, or 60 days or whatever it was. And he had to find another doctor. I don't have an obligation to provide care that won't work. I want my mother to be dialyzed. No, but your mother is brain dead. You're not going to get dialyzed. You don't have an obligation to provide care unless it has benefit, even if the patient's family says, I insist on it. Then what's the other option? You have the option of transferring your care to another doctor who will do that for you. Okay, the other way of saying it is this. I once had somebody came up to me and said, I had a question on step 3 that I couldn't figure out. A patient has 3-vessel disease with 80% stenosis. And the surgeon said, I don't want to do bypass. And the options were to say, what's the other therapy for this 3-vessel coronary disease? And he said, this cardiology question. An HIV positive person with 3-vessel disease. The surgeon says, no, I don't want to do bypass. I want to do this other procedure. And the answer was angioplasty, calcium blockers, statins, extracorporeal oxygen mechanism, ECMO. And I couldn't figure out the answer. What was the answer? I go, oh, I don't know. None of those answers fit. Well, you're the expert. You wrote the book. It's a very clear question. What is wrong with you, Dr. Fischer? With the tone of like, you are just, I'm going to fail and it's your fault. My life will be miserable and it's your fault. It's very clear. An HIV positive person, 3-vessel disease. The surgeon says, I want to do a different therapy. I don't want to do bypass. Is it angioplasty, calcium blockers, a statin, extracorporeal, and some other answer I couldn't remember the answer to? And it drove me crazy, and because there was no right answer. And I start talking to people, and somebody says to me, oh, I remember something like that. Yeah, but it's not a medical question. It's an ethics question. Huh? Yeah, it's an HIV positive person who has clear 3-vessel disease, clearly needs bypass. The surgeon says, I'm not touching an HIV positive person. I refuse to operate on the HIV positive person. I won't do it. So they give these 4 stupid answers, like angioplasty, calcium blocker, statins, and ECMO. And the other answer was refer to another surgeon. Very easy. So the ethics questions on step 3 are mixed with medicine. They're mixed with medicine. A patient wants a therapy, but that's not the right therapy, and the surgeon doesn't want to do something. The answer is refer to another surgeon. If you're brain dead, you're dead. But if it says an option there, it says discuss, meet, confer, explain, then the answer is discuss, meet, confer, explain. Oh, but doctor, my religion says you're only dead if your heart stops. What can I do? He's dead. Reproductive issues, you have the right to an abortion, but the rights to abortion are very idiosyncratic. In the first trimester, a woman has an unrestricted right to abortion. The issues that people have on the legal, legislative end is who's going to pay for it. That's not your issue here for step 3. The ethical issue, remember what I said about legality? Legality can change in a heartbeat. But the ethical issue is a woman has an unrestricted right to an abortion in the first trimester. In the second trimester, it's less clear. All states will say that after 26 weeks, third trimester, you don't have the right, because at 26 weeks, it's a baby, you can live outside the womb. And here's another example of you don't have to agree with it. You can think abortion is all wrong, but it's the answer. She has a right to it. Hi, I'm in my 6 weeks of pregnancy. I want an abortion. Well, I can't do that. I can't ethically do that abortion, but you have the right. Please go down the road and get it, and I'll see you later. I don't do it, but you have the right to it, which means go somewhere else. Second trimester, you do have access, but it's a little fuzzier. Your questions on step 3 have to be very clear. Third trimester, there is no access to abortion. First trimester, there is. Here's something that sometimes people who come from outside our system say, well, of course the father has the right to refuse the abortion. And actually, you don't. You don't have to agree with it. You can think it's wrong. You can think the father has the right to it, but he doesn't because it's not his body. Remember we said that the pregnant woman can refuse HIV meds into pregnancy, can refuse transfusion, can refuse everything because the baby's in her body. When the baby comes out, the father has rights. When the baby's inside mom, the dad has no rights. Ready? There is no father. There's no rights to the father until the baby comes out. Gametes. Have you been donating your gametes? Do you have the right to donate your omelet, your sperm and eggs? You do. You have an unrestricted right to donate them. As a matter of fact, you have an unrestricted right to be paid for them too, because they're renewable. It's like solar or wind power. They're renewable. But you don't have the right to be paid for organs that are not renewable, like kidneys. And in most places, we don't have paid blood donations, but not that it's unethical, it's because it's not safe. Because paid donors have more diseases, because the people who are giving up their blood for money usually have a greater likelihood of HIV, hepatitis C, and other things that might slip through. But the current ethical system is that you can't say, I want to be paid for a kidney. You can donate your kidney, you could donate your bone marrow, but you can't be paid for it. That's the rules. HIV, you have the right to confidentiality unless it might be affecting someone else. Again, we don't tell you who you've been exposed to, but you have the right to. No one's ever been successfully sued for saying, I told look, my patient wouldn't tell their spouse that they're HIV positive, and the spouse is in the waiting room, and I thought they were going to get infected, so I told them. No one ever got sued. Now, that's generally not how we inform people. They say you've been exposed, get tested, but you do have the right to protect other people by saying that you've been exposed. Now, here's an interesting one. This used to be more of an issue. If you're an HIV positive surgeon, do you have to tell your patient, hi, I'm HIV positive, I'm going to operate on you? And the answer is no, because no surgeon has ever transmitted HIV to a patient. And besides, they're wearing gloves. And hopefully not injecting or stabbing himself on needles and then stabbing the patient. So there's no obligation to disclose a healthcare worker's HIV status to patients because there's no risk of transmission. Now, in terms of the doctor-patient relationship, you have to accept a patient. You can't walk up to, patients don't have the right to go into a doctor and say, you have to accept me. Well, my practice is full. Like, for instance, and this is a hard one for people because it came up, I'm in a hospital, it's in a very rough part of town. Matter of fact, it's one of the top 5 gunshots in the country in terms of a number of gunshot victims. And patients, a lot of mental health problems, and a lot of angry people in a rough neighborhood with 2% of the population has a psychiatric admission once a year. 1 out of 50 people. And the patient beat the crap out of the doctor, one of the residents, punched him in the face repeatedly. And there was a big thing where a lot of people were like, well, what can you do? It's the cost of doing business. She has the right to be here as a patient. And the answer is no, she doesn't. She has the right to be seen in an emergency in the emergency room. But all the routine care, she does not have a right to. And she had to be dismissed from the practice. This was very hard for people because doctors have such a big ethical thing about not refusing anybody care that we often forget that just like lawyers have no problem with this. I'm not accepting your case. Why? I don't like you. Number 2, you're probably not going to pay me. Number 3, you're going to lose. I don't accept it. Number 4, you need a real estate lawyer and I'm a divorce lawyer. That's not my specialty. Whatever it is, I just don't like you. I'm not accepting you. So doctors have to accept patients too. The only exception to this is if you work in, for instance, a place where there's emergency patients, like emergency room, you don't have the right to just say, I'm not seeing these people. But you don't have an obligation to have to accept people. Like for instance, me. I don't have room in, like somebody said to me the other day, you have to open up another day in your office in the clinic because you're full. Or I think it's even flattering, because you're great, Dr. Fischer. No, I can't. I don't have time for that. Oh, but you have to. Nope. I have to accept it, and you can't. The need doesn't compel it. Think of it like this. Why did you steal my money? Because I'm really poor. But why did you steal? Because I need it. Well, your need does not win over my right to my property, which is my money. Oh, but I really need it, and you got more than I do, and I need it more than you because you have so much. No. So for a doctor, your time is your property. And patients don't have the right to take your time any more than they have the right to take your money or your property. But once you have accepted a patient, you can't just say, peace out, you're on your own. The patient who wanted medications was told he had to find another doctor, and he did. The patient who assaulted the resident was told she had to find another doctor at another facility. If you have a life-threatening emergency, we will see you. You can't just dump the patient and abandon them. And you have to inform the patient that they need to find another, and if a doctor has to take care of them until they can find another doctor that will take care of them. Can you take gifts from patients? Sure you can. It's nice. Is it acceptable? Sure it's acceptable. Patient gives me a tie. It's nice. They give me food I don't eat. That's nice too. Doctor. I want to give you this tie. I want to give you this gift. It's Christmas time. It's your birthday. Can I give it to you? Absolutely. Here's the other one. Dear Dr. Fischer, I really would like to get my girlfriend a residency position. Feel free to stay in my house in the Hamptons. That happened. No. Dear Dr. Fischer, listen, happy birthday. Here's a tie. Can I have some Vicodin and morphine? No. Can I have calcium blockers? No. Can I have digoxin for a tie? No. Nitroglycerin? No. It's ethically acceptable, and it's nice to accept gifts as long as they're not tied to specific requests. Ready? Hi, Senator such and such. I'd like to contribute to your campaign. Thank you so much. I appreciate your support. Senator such and such. I'd like you to push through and change the law that benefits my business. Here's my gift. No. Industry issues is very limited. This used to be much more common to be able to say that doctors could get all sorts of things from drug companies. But right now, it was changed so that you can't even take a pen with a company logo, or a mug, or a pad with the company name on it, or anything that looks like having advertising handed to you. So the only thing that you can get from them is if there's an educational conference or meeting or grand rounds, and there's food in association with an educational event. That's it. Or sponsoring a meeting, but no pens, no pen lights. People don't realize how it was, even as recently as 20 years ago, 15, 20 years ago. Here's baseball game tickets. Here's theater tickets. Let's all go to the movies. Let's all go to the theater. Let's go see Hamilton. Ugh. Yeah, it used to be that way. Terrible. Sexual contact. Okay, psychiatrists can never have a romantic relationship with a patient, even if you break the relationship and they get a new psychiatrist. For other physicians, although this is not terrific, the idea is that you can't have a power relationship. That's the issue with this. It's like the same as employees. Hi, can you have a romantic relationship with your boss? No. Because it's an unequal power relationship. It's an unequal power relationship. Okay, I got a new job. Go ahead, have a good time. I changed the power relationship. But psychiatrists, the American Psychiatric Association says never, because it is always considered that even if the relationship changed, that the psychiatrist has a certain psychological power over the former patient, so it's never acceptable. Them's the rules. Elder abuse. Certainly can report child abuse, but elder abuse too. At what age is it elder abuse? And it's not a particular age. It has to do with the vulnerability, the fragility of the patient. It has to do with whether there's power. See, the power issue. It's an elder abuse. The person is 60, but they've had a stroke and they have multiple sclerosis, so they're an elder, but they're vulnerable, and the family treats them like crap, and they confiscate their Medicare check, their Social Security check, and their disability check, and they don't take care of their mother. It's elder abuse. My father, when he was entering his late 70s, and I go, what do you want to do? You're going to be 80, you want to move in, you want to do this, you want to do that. He goes, hey kid, I've got 6 months worth of food. I've got 3 firearms. I've got 1,000 rounds of ammunition. I'm waiting for people to come. So you see, that wouldn't have been elder abuse. That would have been being abused by the elderly. So the elder abuse is based on the fragility of the person and unequal power of the person who is older, and you can't, but the key issue is you can report against their will, and that's the big difference between what used to be called spousal abuse, what used to be called domestic violence. The proper term now is intimate partner violence, because you can be abused domestically, internationally. Intimate partner violence is you can't report against their will as long as they are an adult with capacity who's choosing to stay. Can't report that against their will. This one is really hard. Impaired drivers. And I don't mean a drunk driver. We mean a person who's elderly or seizure disorder. You're not supposed to drive, but you don't have the right to do very much. You don't have an automatic right to report to motor vehicles. You certainly don't have a right to remove their vehicle or remove their keys or remove or restrain them in any way. So you're stuck with the namby-pamby answer of advise them not to drive. This one is one of the hardest ones because you're like, are you crazy? The wheels on the bus go round and round, round and round, round. I should be able to report the impaired driver before he kills somebody. I agree with you. It's just not the rules. And it's also different by state. One state says that you have mandatory reporting. 10 states say nothing. 10 states say no driving for 6 months. 10 states say no driving for a year. 10 states say no driving for 2 years. It's completely state-driven and not clear. Torture, here's a good one. You're like, of course you can't participate in torture, but we don't call it torture. For instance, It's not torture, it's interrogation. Enhanced interrogation methods. It's not torture. Okay, waterboarding. Waterboarding was very rarely done because waterboarding, the reason it was rarely done is not a great reason. It's because it takes 3 or 4 or 5 people. You gotta hold people down, pour the water, monitor them, pulse, temperature. And so your question is gonna, here at these last things, is gonna be in a way, phrased in a way that's gonna seem morally ambiguous. The guy is a suspect in a bombing. You're a career military doctor. You're a career military doctor. He may very well have information that is extremely important. You personally don't have an ethical problem with it, and they have passed an emergency law that has said it's legal. And you're not there to do the interrogation. You're there to monitor them, to make sure that they're safe, while other people do the interrogation techniques, whatever. And it's going to be framed in a very morally vague way. You're not doing it, you're just monitoring it, you're a career military or police professional doctor, you're a police surgeon, you're a prison doctor, and you're there to keep them safe during this event. So the answer, of course, is always wrong. And it doesn't matter if you're a career medical, it doesn't matter what the circumstances are, it doesn't matter whether they have information, it doesn't matter if you're just monitoring it, the answer is no. No, no, no. It's kind of like somebody saying, listen, I'm going to beat up my boyfriend. Can you just come by and make sure that he's not dead? And the answer is no. Beat him up yourself. So impaired physicians, what means impairment? Do you have to report to an authority? For instance, if I'm a residency director and the intern is impaired, you report to me. If the chief resident is impaired, you report to me because I'm above them. If an attending physician is impaired in some way, you report to the chairman of medicine. If the chairman of medicine is impaired, you report to the chief medical officer. If it's a private practice doctor outside, you report to the state medical board. So you go up the chain of command. So physicians in training or medical students is the easiest one. You report to the dean, you report to the person running the department, you report to the program director, the dean, the chairman. What about private doctors who are not employed by somebody? That's what goes to state medical board. And so the issue, though, of what you're reporting has to be something like I'm operating drunk, you're using pills while you're doing some sort of medical thing. It has to be something, and it can be like this, it can be sleep deprivation, it can be anything where medical care is impaired. Then you report. It's not things like, I know it's an exaggerated thing, hey, listen, I saw that doctor stealing a car, I saw this guy... You know, Dan, that's not what we mean by impaired physician. Hey, I saw this guy. He does some horrible thing in his personal life. You know, he mixes reds, greens, and blues. He does some things. He cheats on his wife. She cheats on his other. It's not these other moral, ethical things. He gambles in Las Vegas and loses. He has a gambling addiction. Here's a good one. Here's a good one. You know, not that you see that too much in doctors, but you say, yeah, he's in Vegas. He's a compulsive gambler. Well, how's his medical care? Well, it's okay. He's a compulsive gambler. Yeah, but he's not impaired medically. Not impaired medically. It has to be impaired medically, not on personal ethical choices. So your ethical duty is to report only things that will harm innocent human beings. I hope you've enjoyed the ethics section. I certainly do. I have a textbook on medical ethics, and I care about this very much because I happen to believe that even with those people who may have lapses in their ethical duties, my experience is that in the core of every doctor I've ever met is still the letter of the personal statement they wrote to medical school, the personal statement they wrote to get a residency, where they talked about how much they wanted to serve humanity, take care of suffering people, and do the right thing. And I feel that even in someone who might seem the most mercenary and mercantile of doctors. I once had an ethical issue a couple years ago when I had this little existential crisis where I said to a friend of mine, I said, and she had long-term metastatic cancer, And I said to her, I said, gee, I don't know what I'm doing. I'm helping a bunch of people get step 2 grades, that they're going to fake it with some program director to get a residency position. And I met a whole bunch of these people and they just don't seem very sincere. Who am I helping? And she said, Conrad, even the insincere people need to be competent. And that had a very great effect on me. So, one, I believe that you are studying this and that you have goodness in your soul and you're going to do the right thing for people. Number 2, you will, at the very least, be competent.